It's one thing to have periods. It's another thing to have periods so painful that you can't function, at least not without painkillers. You can't go to work, you cannot go to school, you can't carry out your normal activities due to pain. And you may find that your period is becoming more painful by the day, or you're needing more and more doses of painkillers, or it may even be that the painkillers you're using, maybe you've been using Tylenol or paracetamol or acetaminophen, depending on what it is called in your country of residence, and you need more, it's not even giving you the needed relief. The pain is worsening. It's time to give it a check, because periods can come with some level of discomfort. For some people, they are so fortunate and so lucky, they have nothing, they feel nothing. During their periods, they are fine. But for some other women, it's a hell of a ride. During periods, there's a whole lot of pain. Historically, periods were seen to be something sacred. Some communities even have some spiritual connotations for periods. So it's like, oh, we don't want to talk about this. Bear it. It will pass with time. Something you can cope with. But then you find that you're not coping at all. It may also be that you may have some other troubling symptoms, such as painful defecation during your periods. Passing feces, passing stool is just so painful. Also, urinating is so painful. And some women find that even after the periods, the pain persists. As the period starts, the pain precedes the period. As the period starts, the pain persists. After the period, the pain persists. Some women have painful sexual intercourse, which we call dyspareunia. But then there's pain right deep inside. Some other women have, alongside, they have persistent pain. There is always pain down there in the lower abdomen. This pain is always there. So when you're having things like this, especially if you have tried other remedies, some people prescribe special diets, or try these diets, try that for less painful periods, do so and so exercise, take this tea, take warm water, especially when those things are not working, then you may have to look into seeing a gynecologist, because that may just be endometriosis. And it's important to make this video because a lot of women suffer, are in pain for months, even years before they get a diagnosis, most especially among women of African descent, because the thought has been that it is rare among women of African descent. So that can also contribute to a delay in diagnosis. But this is not the case. It is not as rare as we once thought. This is why you need to know, so that you can advocate for yourself. If you have this kind of debilitating pain so bad, you're almost out of your mind, you can't function, you can't do anything, it's almost like it's affecting your work, your life, your relationships, then it's time to see your gynecologist, and it should not be dismissed as just period pain. What is endometriosis, by the way? Endometriosis is when you have parts of the uterus, parts of the innermost part of the uterus, which we call the endometrium, when you have it outside the uterus, when you have it on other sites outside the uterus. For instance, if it's on the body of the uterus, not in the innermost parts where it's supposed to be, it can cause such pain. If it is on the ovaries, it can cause what we call ovarian endometriomas, and then it can also be scattered all over the belly, the abdomen. So that can happen. In some cases, it can be found on the belly button, such that during periods, the belly button appears darker than normal, and it may resolve after the periods. The belly button may assume, because with that bleeding into it and healing, the belly button may assume a peculiar appearance. Some people have this, outside where they are supposed to be. They may have this innermost part of their wombs located in the lungs, such that with every period they are bleeding into the space around the lungs till it becomes a problem. Some people actually have what we call hemoptysis. They start to cough up blood. Some people have it in the brain. Some people have, in fact, there are so many bizarre manifestations of this disease called endometriosis. So what actually causes it? The exact cause, find pathway through which this happens has not been agreed on. There are different thought processes, there are different theories, rather there are different theories as to why this happens. Some people think, oh, during the period during the menses, instead of the blood going all out, some actually go back up through the fallopian tubes into the rest of the belly, into the rest of the abdomen, and amongst other theories, but this is not an academic exercise. It is just to create awareness that endometriosis is not as rare as we think among women of African descent. It is commoner among women in their 30s. That is the commonest age group, but I mean, it very well occurs in women younger. But like we said in the beginning, some women struggle with this condition for years before they are eventually diagnosed. You can have it in adolescents too, in teenagers. So there is need that if you have such degree of pain, such level of pain, it should not be dismissed without being properly evaluated so that proper treatments can start and not just herbal treatments or painkillers are an essential part of the treatment, very useful, but there are other therapies that need to be started and started on time. So this is the purpose of this video. I would like you to share this video with women around you, because some people may be suffering and suffering in some women may be suffering and suffering in silence. They don't want pity, they don't want the stigma. I mean, it's funny, but they don't want the stigma associated with having painful periods. So share this video with women in your circle. You need this. Yeah. Thank you for watching.